Hey everyone, it's Phil Hall of Westfair Communications, and thank you for joining us on another episode of our Westfair video conversations. Joining me on today's program is Harry Glorikian. He is managing partner with New Venture Funds. We're going to be talking about healthcare, the tech side of healthcare in particular, and how it's been evolving. And Mr. Glorikian, thank you for joining us on today's program. Uh, what have been the most significant changes in healthcare technology and the use of data therein during these last several months of the pandemic?
There's been quite a few. So many it's sort of difficult to go through, but some of the most impressive ones have been how quickly we've been able to sequence the coronavirus. So if you think about, it took about, I think it was a day and a half, 2 days to get the entire sequence. So to compare that to when we had SARS or MERS, that took 3 or 4 months. So that gives you sort of an order of time. And then if you look at the data that everybody's been sharing to create a vaccine, we've gone from knowing nothing about this virus to being able to create a vaccine probably by year end. That is unbelievable when you think about it from, my experience. And the other area is telemedicine, where pre-pandemic, trying to get anybody to do it was sort of a challenge. And post-pandemic, everybody's like, I can't live without it. And they're, moving at the speed of light, and it's changing the way that we interact with patients. So those are two just examples that I can bring up off the top of my head.
With telemedicine, obviously prior to the pandemic, it had been mostly used in areas where people didn't have easy access to medical care, primarily rural areas. But after the pandemic is over, are people going to still go online to speak to their doctor the way we're speaking now, or do you see people going back to the doctor's office?
Well, there are certain conditions that are always going to require, person-to-person interaction, or I need to feel something or be there. But there's a lot of interactions, especially for generally healthy people, that you don't need to go. You don't need to sit in traffic. You don't need to sit in a waiting room. All these things. I think preoperative interactions could probably be done by video. Even post-operative interactions might be done by video. So there's a lot of rethinking. And then when you take that and attach it to, something like this that can monitor me, the physician can have a tremendous amount of data on me, manage me, and because of I don't need an appointment necessarily sometimes to do this. I might be able to see them more often. And some of the doctors have come back to me and said, no, I really like it because I can see into where the person is living, which gives me some insight about their living conditions and things that I can't see when they're in my office.
In your opinion, sir, did the IT side of the healthcare industry meet the challenge that the pandemic created, or was it caught off guard in some areas?
I think it was caught off guard in many areas. Those institutions that had been playing with telemedicine and some of these things were prepared because they had been playing with it long enough and they could ramp up. Those places that had nothing were scrambling to sign contracts. And I think that, we're very lucky because the tech industry has over the years been stepping up towards health. And so that enabled us to take advantage of video conferencing and things like that. As you've seen a dramatic shift in companies like Zoom or Microsoft Teams. All these have really stepped up their capabilities in the last short while. It wasn't just the medical industry on its own.
What about the different healthcare systems around the country? Are they been able to share data with more ease now than they had, say, 6 months ago?
So if you're talking about interoperability between sort of their electronic medical records, the answer is no. If you're talking about, that's a much bigger problem that you really, I think it rises to the level of Congress to sort of enact something to push it to happen. If you look at it from a sharing of scientific data around coronavirus, it's been unbelievable level of sharing that has moved the ball forward. So it depends on what you're referring to. I think the companies that have made some of the sharing or moving your data around the easiest might be a company like Apple, and not necessarily one of the electronic medical record companies.
Mm-hmm. Now, I'm asking because actually from personal experience, my mother was seeing a doctor at one hospital for consultation on potential cancer and was not satisfied with what was happening. And so she went back to another hospital, which is some distance away, has nothing to do with the hospital she left. And she said to her amazement, her records were just were passed over. She didn't have to go through the whole rigmarole of calling the first hospital saying, please send the records to my new doctor.
So if they're on the same system, like around here, there's Partners Healthcare, which is made up of many different hospitals, but they're all on the same system. So transferring information can be easier. But if you're in two different systems, two different hospitals, sometimes it can be very difficult to share information. So I think it depends on your geography.
Yeah. I'm here in Connecticut, so whatever it is, so the two hospitals mercifully were talking to each other, and we didn't have to play telephone tag to get records sent over. But of course, the American healthcare system is, we also have to deal with the federal government, particularly if you're dealing with Medicare and Medicaid, which was especially overburdened with the pandemic. How did those systems hold up during this time?
From what I can see, they did a pretty good job. I mean, I'm not going to talk about response on diagnostics or those sorts of things because that was a disaster, but they did see the need to change some of the regulations, which would allow for telemedicine to take place easier, and also reimburse at the same level as a personal visit. Mm-hmm. So, before, reimbursement was almost nothing. So if you're not getting paid for something, why would you do it? Yeah. But if you're getting paid for it at the same level, it sort of encourages people to start using the technology. And even my doctor has said to me, wow, I'm going to see patients in the morning, and then in the afternoon, I'm going to switch to telemedicine because, I can see more people. Yeah. I can see my healthier patient population. It just will make life easier. So it's interesting for him even to be like, wow, that's going to be useful to me.
In terms of reimbursement, I saw a report the other week from Moody's Investor Service saying there's a bit of a wild card as to whether the reimbursement that is currently in place because of the pandemic and the use of telemedicine would remain in place after the pandemic is over. What is your prediction on that?
So I'm really hoping that it continues. My hope is that this pandemic is not going to go away tomorrow, contrary to what everybody wishes. And so the durability of the change, I think, should be and will be longer lasting than it is today. And what are you going to do? You're going to go back to all these people that spent all this money putting all this in place and say, oh, sorry, reverse directions. I think that would be, I don't know. I don't think that's going to do anybody any good. I think we're on the verge of a opportunity to reset healthcare mm-hmm. and make a big change that it's always needed. And the pandemic, if you want to look at the silver lining of it, has been the opportunity now to reset and change things. Mm-hmm.
Now, maybe I've missed this story, but have there been any reports of major cybersecurity breaches of the healthcare system during the pandemic?
There's cybersecurity happening all the time, pre and post pandemic. It's one of the areas that the healthcare industry has not always been very good at. Like they've never been at the same level of, say, banking
Hmm.
or financial systems. And we need to rise to that occasion and be more diligent about that, because healthcare data is valuable to those hackers that are trying to get access to that data, personal data.
Well, I've covered the banking industry for many years, and I can assure you, and I'm sure you're aware, that the banking industry hasn't always been cutting edge when it comes to technology. So if you're saying healthcare is behind the banking industry, that's not very optimistic.
No, but I do believe that they're probably farther along than the healthcare industry.
Mhm.
Go ahead. I'm sorry.
I mean, outside of telemedicine, what do you see as the growth areas in healthcare IT?
Uh, well, healthcare IT, I see a lot of diagnostics is going to be an area that's going to move forward.
Mhm.
Sensor technologies are moving forward incredibly rapidly. Uh, where you see telehealth integrated with, say, an artificial intelligence system that would give the physician information on the patient and give them relevant information. That's where I see image analytics, where you can look at x-rays and radiology, and where the AI system can help you identify things much faster. That all of these areas are areas where I'm seeing incredibly quick movement. We still have to do all the clinical trials to make sure that what we're seeing is accurate, but it's moving incredibly rapidly. So as an investor in the space, it's like being a kid in the candy shop. I mean, there's a lot of opportunity. You have to sift through to find the special ones, but it's not boring, I can tell you that.
We mentioned the banking industry. Obviously, in banking, there's a whole subsection of the Fintechs who are bringing a cutting edge technology to the financial services world. Is there an equivalent over in healthcare, maybe call them the medtechs for lack of a better word, which are seeking to change the way their industry operates, the way the Fintechs are changing banking?
Uh, I, it's hard because everything's not in one place necessarily, like you would have a fintech. But if you looked at, if you look at CVS and Aetna, they're bringing stuff out of the central hospital into these places. So the technologies that are feeding them. Or if you look at, like yesterday, Illumina announced a deal where they're going to buy a company called Grail, which does a function called liquid biopsy, which basically the ideal outcome of this will be is you'll be able to detect cancer
Mhm.
from a simple blood draw early. And the earlier we find it, the better we are at treating it. So you can imagine one day you'd go to a CVS, give a little bit of blood, do an analysis, and keep you healthy for a longer period of time, right? Or stave off that cancer for a much longer period of time. So there's a number of different places that are seeing booms almost simultaneously moving forward. Anything on your, I was just looking at an app to download, that will constantly look at my heart rate, my blood saturation, monitor me while I'm sleeping. And it's a free app. So, you look at these things and you think, this is just the beginning. Technology is moving. I can imagine that Siri is going to ask me one day, like, how you doing? I noticed your heart rate was a little faster earlier, right? That is not 10 years from now. That is now. It's happening. These systems are being built today. So there's some fascinating shifts going on where I think people are really going to be able to take control and manage their own healthcare and not be as dependent on a third party. And if they are dependent on a third party, that third party has longitudinal information on them to see what happened over time, as opposed to, when you take your car and you say, it's making that noise. It's just not making it right now. Now that noise is being monitored, and so you'll be able to see it ahead of time and then manage it appropriately.
Is the United States in the leadership role of this technology globally, or are there other countries that are ahead of us?
So we have some incredibly creative people, thank God, in the United States, sort of pushing the envelope on these things. If you said from a centralized data perspective, being able to really move forward faster, I would say China has a leg up on there, but you're giving up freedom for progress. So you got to weigh which one you want to do. I do believe that we have a lot of cutting it. There's some really good stuff coming out of Israel. Few things out of European Union. A lot of stuff out of the US right now. So I think at the forefront of the technological standpoint, we're still at the front edge.
I mean, if we were to rewind this conversation, when we started talking about telemedicine, it mentioned that it had been used in a lot of rural areas where there wasn't access to medical care. But with all of this technology coming in, what happens to the rural hospitals and the overburdened, financially frayed urban hospitals and other smaller healthcare facilities? Are they going to be able to afford all this new technology?
Well, if you think about it, technology has been de-inflationary in a sense, right? You get more every year for either the same amount or less. If you think about everything that your iPhone does, you used to have to pay for all those things separately. It's all packaged in one device now.
Yeah.
And generally speaking, a lot of it is free.
Mm-hmm.
I do believe that there's going to be a struggle to understand what the new business model is and how do you make money at it. That's the shift that sort of concerns me the most, because if a hospital goes out of business,
Yeah.
a lot of people get hurt, right? If a corporation goes out of business, it's not good, but it's not going to have the same effect on human life. So there is some shift that the hospital systems need to be aware of and manage, because I don't think it's not status quo. We're moving from sick care to healthy care.
Mm-hmm.
And when you have healthy care, you need to monitor patients and keep them healthy, and that's how you make money. In a sick care environment, I only get paid when I do something. And that is a big shift that we've been going through since the Affordable Care Act got put in place.
Well, Mr. Glorikian, we're coming to the end of this episode, but if our viewers wanted to continue the conversation with you, how can they get in touch with you?
My website at www.glorikian.com, glorikian.com, and also I have a podcast called Moneyball Medicine. So if they just type in Moneyball Medicine podcast, they'll be able to listen to different episodes where I'm talking to industry leaders about some of the changes that you and I have been discussing.
Excellent. Harry Glorikian, thank you so much for being a guest on today's program.
Thank you.
And folks, we'll see you again next week. Have yourselves a good one.